Hello everyone, Dr. Suneel Dhand, internal medicine physician. Welcome to another video. I want to talk about a very important issue in this video that I've talked about previously. That is how we go about treating high blood pressure. I believe this is a scandal of epic proportions. The guidelines from our heavily corrupted medical authorities under the influence of their best friends in the pharmaceutical industry keep on getting stricter and stricter every year. More and more people keep getting put on blood pressure pills, and not enough basic questions are being asked about whether we are doing the right thing, because I believe there are a lot of people out there, hundreds of thousands, probably millions, especially our older citizens, who are being way overtreated and are suffering adverse effects. Now, am I saying that everybody out there who's on a blood pressure pill must immediately stop it themselves? Of course, that's not what I'm saying. I'm saying that I hope you can listen to my reasoning, come to your own conclusions, and then work with your own doctor if you think this applies to you or potentially applies to a loved one. And I'm very surprised, or maybe I'm not that surprised, that more of my colleagues don't raise questions and red flags about what is going on out there. I don't think I'm a genius, or maybe I am a genius, who knows? But hey, I say that tongue in cheek. I simply try to look at the world through the lens of common sense, through the lens of being logical and rational, which to me is how a doctor should be asking questions and trying to get to the bottom of problems. But this seems to be lost in today's medical environment. Everybody within the medical profession seems to blindly listen to whatever their heavily corrupted medical authority tells them to do, without asking these basic questions. And I want to talk about a study which kind of backs up my concerns. But before I do that, I want to remind everybody about my particular worries when it comes to how we are treating high blood pressure. And again, I have talked about these issues, as I've said, in previous videos where you can see a more in-depth discussion. But for now, let me summarize my three main concerns when it comes to how we treat high blood pressure. Number one, the complete lack of focus on insulin resistance as a key driver of high blood pressure. In fact, almost everybody under the age of 65 who has high blood pressure, there may be some rare exceptions, but for almost everybody, the main driver is insulin resistance. How often have you heard your doctors talking about this? But insulin resistance develops over many years, sometimes decades, primarily a result of a poor lifestyle. What people are eating now, terrible amounts of ultra-processed foods and sugars, not moving around enough, having too much stress. All of these result in insulin resistance developing. And actually, as well as high blood pressure, high cholesterol and pre-diabetes leading to type 2 diabetes are basically manifestations of the same root cause. So what I want to know is, why don't doctors talk about this more? Telling people you have high blood pressure because of your insulin resistance. And if you reverse your insulin resistance, which can be done naturally and holistically if you're given good advice within only a few weeks, why not focus on that, as opposed to thinking that the answer is to throw pills at people without addressing the root cause? So that's my first issue with how we treat high blood pressure, not even addressing the elephant in the room: insulin resistance. Number two, how we treat high blood pressure in the hospital. I made a video about this that got a lot of views. It is a true scandal, and it goes on because of a total lack of common sense and protocol following. So the classic scenario is this: somebody who is sick, who is on blood pressure medications at baseline, they could be on 1, 2, 3 blood pressure pills. They come into hospital and their blood pressure is running low. Their top number, systolic number, might be in the low 100s, and then they get 2 or 3 blood pressure pills on top of this. And what do you think happens next? Their blood pressure drops dangerously low. The top number could go to the 80s or 90s. This goes on every single day in hospitals across the country. And it is because the parameters for administering blood pressure pills should be higher than they are. You cannot obviously give blood pressure pills to somebody who is sick and running at a low blood pressure. You wouldn't think I need to say this, but trust me, a lot of nurses out there know that rapid response times, when patients have a mini crisis, they may become unconscious or their blood pressure drops dangerously low, usually happens 30 minutes to an hour after medications are given. Many seasoned nurses will tell you that, so we should be much more careful about administering blood pressure pills to people who are already sick. And number 3, how we treat blood pressure in our older citizens. Now, of course, there's no hard and fast age cutoff. There are 65-year-olds out there that I meet who are in the body of a 45-year-old. And conversely, there are 65-year-olds who look like they are 85. We all probably know people like this, but let's just say for argument's sake, someone above the age of 65. That's the most common group that this happens in. They may have been started on a blood pressure pill when they were in their 40s or 50s. They had one medicine initially, then they got 2, 3 medications for blood pressure. And what tends to happen, blood pressure might slightly increase above the age of 60, but then at the more extremes of age, when people get to their late 70s and 80s, blood pressure tends to drop. And there are millions of elderly people out there who are on way too many blood pressure pills. And what do you think happens next? They're not getting enough blood to their brain and complications develop. It's a very sad situation, but that leads nicely on to the study that I want to present to you. So here we have the study here published in the Journal of the American Medical Association, JAMA, Deprescribing of Antihypertensive Medications and Cognitive Function in Nursing Home Residents. And I'm going to go straight to a summary which was published here in Medscape about this particular study. Yes, this has been my concern for a long time, an elderly population being overtreated with blood pressure pills and not enough blood getting to their brain. Let's take a look at this study. So the headline here is that deprescribing antihypertensive medications in this elderly population was associated with a 12% lower likelihood of cognitive decline in older nursing home residents. That does not surprise me at all. So this was a large study, over 12,600 long-term care residents. Mean age was almost 78. With stays of at least 12 weeks from 2006 to 2019. That's what you look for in a study, a large group of people studied over a long time. Residents who experienced either a reduction in the total number of antihypertensive medications or a sustained 30% decrease in dosage for at least 2 weeks were classified as deprescribing users. Those with no medication changes were considered stable users. And it looks like the stable user group was much larger than the deprescribing group, not a surprise. The primary outcome was cognitive impairment, and they used a cognitive function scale. And the median follow-up duration was 23 weeks, so almost half a year for the deprescribing users and 21 weeks for the stable users. So let's look at what they found. Well, they found that deprescribing antihypertensives was associated with a 12% lower likelihood of progressing to a worse cognitive function score per 12-week period. Among residents with dementia, deprescribing was associated with a 16% reduced likelihood of further cognitive decline. At the end of follow-up, 12% of residents had a higher cognitive function score and 7.7% had a lower cognitive function score. And they did another analysis here which showed that the association remained intact. And their conclusion was this work highlights the need for patient-centered approaches to deprescribing, ensuring that medication regimens for older adults are optimized to preserve cognitive function and minimize potential harms. So there you go, and that result does not surprise me in the least, because it's very obvious that people who are at extremes of age, especially someone who's quite frail and in a nursing home, if you give them lots of blood pressure pills, they're going to get less blood to their brain. They're going to suffer cognitive adverse events. They're going to be at risk of other complications as well, like feeling dizzy and falling. But we have a massive overprescription problem right now. It's an absolute tragedy. When I work in the hospital, I often see patients admitted from nursing facilities on 20 or 30 medications. I kid you not. And often, half of the medications are to treat side effects of the initial medications. How did the world of medicine get to a state of such clownery? And in my opinion, especially over the age of 75, I believe that over half of all medications out there could be safely deprescribed. Obviously, this should be done under medical supervision. And I can tell you that when I work in the hospital, I often do just that. And I'll sit there with the patient and often the family, the children actually, of patients that age. And I will say, well, look, this is what I'm thinking about your awful medication list. Let's think about deprescribing it. And I'll go over everything. And I'll often manage to get them off lots of their medications. And they will be so thankful. They will say, Dr. Dhand, no doctor has ever done this with us before. And I'll get follow-up afterwards. Obviously, I tell them to follow up with their primary care doctor, but I'll hear from them 2-3 months down the line, 6 months down the line, a year down the line, and they're doing well off their medications. Again, go figure. They didn't need them in the first place. Am I saying again that they don't need any of their medicines? That's not what I'm saying. I'm saying that a large proportion of medications out there, particularly in the elderly population, although quite honestly, it's getting younger and younger, but if we stick with the elderly population, so many of them are absolutely not needed, and pharmaceutical companies are making so much money right now from our elderly citizens. And guess who suffers in the end? It is the person who is over-medicated. An absolutely tragic situation, but I did want to share that particular study with you in this video because it kind of backs up what I've been talking about, and it makes perfect logical sense. We have to do better in medicine. This is not the vision I had in mind as a bright-eyed, bushy-tailed student going into medicine. I thought the job of a doctor was to fix a problem quickly and then wave goodbye. But the paradigm has shifted. It's all about chronic disease now, getting people on as many lucrative medications as possible for as long as possible. Well, I don't want to be part of it, and I will always strive to be as conservative as possible with prescribing medications. We use them only when absolutely necessary, but they are not pieces of candy to be dished out. Lots of other medications, even away from high blood pressure pills, are given far too easily to the elderly population with lack of evidence. Statins also come to mind, but one of the best things that I get to do as a doctor is deprescribe these medications, which so many people do not need, and the medicines are actually more likely to harm them, as you saw in that study. Thanks everyone for watching. Dr. Suneel Dhand. Feel free to leave a comment down below. Share your story of overprescription, either in yourself or a loved one. I'm sure there are a lot of stories out there. Wishing you the best of health. Check out my website, my health programs, and my free newsletter. Those links are down below. Hit the like button if you like this video and the subscribe button for more similar videos in the future. We will speak again very soon.